Welcome to the Lynn Lowdown. I am joined by Jared and his wife. How are you guys doing?
Good, thank you. How are you?
I'm maintaining. I'm
Yeah,
maintaining.
I would say hanging in. Yeah.
Yeah, pretty much. So, we got a lot to chat about, especially for you guys. You guys have, you guys been going through some stuff. You know that you were exposed to COVID-19. Just talk to us about everything that's happened the past couple weeks.
Yeah, so I'm a certified nurse midwife at Mass General, and it's been, as you can imagine, really busy and kind of a breakneck pace at the hospital in terms of mobilizing resources and staff. And so, I've been busy at work. And a few weeks ago, I found out that after I'd seen a patient that she had gone on to test positive for COVID-19. So I had to call occupational health, and then because of a few other symptoms, they chose to take me out of work and get me tested. And so with that, I had to go into self-isolation, which meant that we have a 5-month-old baby Henry. Mm-hmm. And so it meant that I couldn't take care of him. Jared had to kind of move downstairs and sleep on the couch and take care of the baby. And it was about 5 days of waiting for results. So obviously they were negative. We were all healthy. We were so grateful. And I'm back to work. Everything's gone, has been fine with the reentry back to work. But yeah, it was a really stressful, tough few days.
Yeah. Jared, how was it? How was it for you? Just knowing she did the test, and then you kind of have to, you can't be around your wife for a little bit because of this. Well, how was that for you? Just having to adjust, and you have a newborn as well. So usually when you have a newborn, it's a team thing with a newborn because newborns like to sleep, cry, eat. So how was that for you just to adjust to that?
Yeah, it was tough. I mean, the biggest thing was I was nervous about Catherine's health, and we were nervous about the results of the tests and hoping that she was going to be healthy. Definitely missed her and just being with her and also sharing Henry with her. One of the hardest parts was it was just sad because I knew she was sad to not be able to hold Henry and miss out on that for the time being. But thrilled that the results came back the way they did. And they're just really proud of her, that the work that she's doing and the women and babies that she's helping in these difficult times.
Yeah, I'll go with you first, then I'll come to you, Katherine, with the follow-up. Knowing your wife is working in the front line as one of the essential workers working in the healthcare field, a field that's really needed at this time for you as her husband. How's that to see her? She has to go out there, put herself out there at risk every day just to help others. How's that for you?
I certainly worry about her because I know what she is exposed to, and I also know the toll that can take emotionally, and it being a vulnerable time, an exciting time, a vulnerable time anyway to have a newborn. I think can make it all the more harder. But like I said, I'm really proud of her, and I think when Henry's older and we tell him what it was like to live in the time of coronavirus, we'll talk about how his mother was there at the hospital, helping take care of people who needed it. So.
Yeah, Katherine, for all of us, we hear about all the nurses, doctors, healthcare workers. They're always at work, but we don't really know the details of their day to day. How is it for them? So can you just kind of give the audience a little grasp of the day to day operations for those that are working in hospitals and nursing homes and etc.?
Yeah, I mean, what I want to say is I think, I have been so grateful for how much sort of outpouring of support and gratitude there's been to health providers and nurses and midwives and doctors. I also just really want to recognize there are a lot of essential workers, whether it's the supermarket employees, CVS employees, people who just, anyone showing up to work right now with these essential services is doing a really brave thing. What I would say about being the feeling of the hospital is people are so committed. They're so hardworking. They are there for their patients, but we're not superhuman. We have the anxieties, we have the worries, we have the fears for our own health, the health of our families. I think I heard it best. There was a hospital chaplain. He was actually in LA, but he had given like a blessing to an emergency room team. And I just liked what he said, which was like, he was like, you are normal people doing sacred work. Mm-hmm. And I sort of think about that because it kind of gives me permission to like not have to hold myself to some kind of like impossible standard to not be scared going into work. But it just sort of hold that I'm like, this is sacred work, taking care of people in illness, taking care of pregnant women, taking care of families has always been a privilege, and it continues to be a privilege even in this moment.
Could you describe the first couple weeks when the pandemic first started and the cases first started, and then you started slowly seeing that we were kind of edging towards the way of everybody having to stay home or everything having to shut down? Can you kind of give the first, like, what was the first reactions happening at the hospital when you guys are hearing all this information coming in, and then you guys hearing that the possibility of a lot of folks are going to be out of work or have to stay home to keep themselves safe? What was the first things happening in the hospital?
So in some ways, I have been really grateful with our state and with the hospital I work with, that I think we are like learning the lessons from other countries. So we were able to see what happened in Italy. It hit the West Coast first, and then it sort of went to New York. And so I think, at least within my department, I know they were on the phone all the time with hospital leaders in Washington, in California, in New York. So, but in those early stages, it was this feeling of like, okay, this is coming. It's just there's no, it's not a matter of if, but when. And then just realizing, like, do we have enough supplies? Do we have enough tests? Do we have enough staff? And so, and I think this has been made national news, and this is not a surprise. We did not have enough tests, and we did not have enough, protective equipment. I think it's improving, but those early weeks, it was really difficult because we were so limited in who we could test and what supplies we had. I definitely think it's improving. So I think we're in a better spot for that than we were 4 weeks ago. But I think that's come at cost, huge cost. And certainly we're seeing that in certain communities where I work in Chelsea has become the epicenter of the outbreak in Massachusetts.
Now, Jared, as a lawyer, I'm sure there's going to be certain legal things that are going to be coming your way, especially I know you did some discussions last week at North Shore Latino Business Association, trying to guide the small businesses and trying to get through this. So legally, what are some of the things that are concerning you, or some of the things that you have been hearing about that, that lawyers are taking task on?
Yeah, absolutely. So one big issue, and one that I talked about with the North Shore Latino Business Association last week, and we're doing another session on that on Thursday in Spanish language version of that, is specifically for small businesses about their commercial leases. Businesses that have been forced to shut down, whose revenue have been impacted incredibly hard, can't afford to pay rent, and thinking about what their options might be, how they might approach a negotiation. That's certainly one big area where lawyers can think about and be involved and be helpful. The other big thing for small businesses right now is applying for the loan assistance and thinking through their options at the federal level, the state level, private programs that are out there, and there's roles for lawyers there as well.
And small business is so essential, especially in the city of Lynn, because I know over the past year or so, we've had so many small businesses opening, and this is, for them, the ones the newer small businesses that had recently opened, this is a bad timing for them, because now they're kind of taking a major hit because the customers aren't coming in, and they have to scale their operations back so much.
Yeah, and there's so many levels of devastation with this. There's so many levels of grief. I think everyone is probably most importantly concerned about the health of them and their families, but the economic fallout of this is unprecedented. Mm-hmm. And, I know that even healthcare organizations are trying to think of how do we support people in terms of food access? How do we support people in terms of childcare options? I know, Jared, you can speak probably a little bit about some of the issues around housing and, people not being able to pay rent and what it means for them.
Yeah, I think specifically on the housing, there are certainly resources that are becoming available, and would encourage people to reach out to the Lynn Housing Authority as a place to start on some of the rental relief programs, and keep track of what your legal rights are, because that's changing, and the legislature is acting on that to give tenants more protection. On the small businesses, it's really devastating. And like Katherine said, there's a lot of ways we're going to be hurt by this. And I hope that we will continue to think about well thought interventions that can try to mitigate some of this damage, whether from a health perspective, from a housing perspective, from a small business perspective, because it's not too late to try to save these small businesses and make sure that they're ready to come out of this in a position where they can continue to be such an important part of the community.
And also, Katherine, from a health perspective, because there are a lot of people who don't have insurance.
Yeah.
And, some folks who may have the signs, they might not be able to get checked out. And if they go to maybe like urgent care or community health centers, the community health centers are pretty full. Now they're getting more demand because it's so much. And so how, we have to look out for the people that don't have health insurance as well. We have to try to make sure that, we provide them with the proper support that they need to make sure they're healthy too.
Yeah, so that's it's essential, and I think it's part of why you're seeing disparities in the outbreak is exactly your point, which is that we went into this pandemic without everyone being equal, without full health equity. What I would say is I think we're sort of lucky in Massachusetts that the state is sort of committed to paying for like testing and treatment for all people. Again, I don't work in the Lynn Community Health Center, so I don't want to speak for them, but I know that in Chelsea, we have opened a respiratory health clinic where people can be evaluated. And again, it does not matter of their insurance status, and more importantly, it does not matter of their immigration status. So that's what's happening. That's what's getting mobilized really quickly throughout the state, is to basically, like, if people are sick, that they can get care. There'll be no questions asked about their immigration status, and that will facilitate that treatment.
Yeah, working in Chelsea, how many residents would you say come in on a daily basis?
So the respiratory clinic has only been open for about a week, and I was on a call this morning. I think they saw 140 people yesterday, and then that was up from 70 the day before.
No.
So the need is there. I like all the best minds at the hospital are there to try and sort of address this huge public health crisis.
Yeah, and Jared, you're on the school committee. Just moving forward, the date has been set for May 4th for schools to come back. There's a lot of optimism there, and some people think the school year this might be just a wash for the rest of the school year. Can you give us a little details of some of the things that you've been hearing?
Absolutely. I think that's right. Nobody knows what's going to happen, and we're going to follow the guidance and make safety the top priority. If it's possible to try to salvage some time in school, we'll put our best minds on it. But it does look like that's not the likely path. And I think we're working as hard as we can, the teachers and the educators of the district, to try to create alternative forms of learning remotely. And that's really, it's a huge challenge, and I understand the struggle that parents and families are having to try to make that work. But it's something that we're working on, and you should be seeing more coming from the district about creative ways to create those opportunities for learning.
And also for the students that are set to graduate this June, is there something that you guys are going to be working on or maybe working on now to do something for those students who are set to graduate, and we don't know if they'll be able to walk across the stage in that case? Yeah,
I mean, one of the things that Katherine mentioned earlier that she's mentioned over the course of this is that there's so many different levels of grief throughout all this, and there's a big amount of grief for our graduating seniors that have been sort of robbed of this really cherished experience of going through your senior year and the prom and graduation. And absolutely, I think we're going to try to think of creative ways to recognize that. There's also a serious educational issue around graduation for students who were on the cusp of completing the graduation requirements in order to be able to get that diploma. And we're being creative around that as well. We just relaxed some of the requirements for students that needed non-core credits to graduate so that they can graduate even if they don't have them.
Mm-hmm. And God, 4 more minutes left that you have. So, Katherine, once again, can you just emphasize to residents on how to properly take care of themselves? Either they go out for a few minutes or so and come back in, just the proper ways to avoid them catching the COVID-19.
Yeah. So, I mean, the recommendations would be the same for everybody. I mean, you try to stay home as much as you can, honestly. So, and think about like, your family unit being like, so if there's 5 of you in the house, you guys are kind of in it together. So that you guys are really only truly interacting with yourselves. So it's not like your kid, your child goes to play with another family's house and then they come back in, which is tough. We understand it's really tough, especially with children. If you do have to go out, try to sort of minimize how many times a week you need to go out. So try and just go to the grocery store for like once a week. You've seen that the recommendation for masks for everybody. So when you go out, make sure that you've got a mask. And then just excellent for hand hygiene, whether it's 20 seconds washing your hands. If you manage to find Purell, that would be, or a hand sanitizer, that would be well. And then the other thing is, if you feel like you're beginning to get sick, is to try and contact a health provider quickly. And so again, most people, I really want to emphasize, most people are gonna recover from this virus. That is the majority of people. So you may just be advised to stay home. You may, to try and isolate as best you can from family members. But it just is so that you're on the radar of a health provider, so people can check in and they'll advise you if you start to feel worse. Mm-hmm. I mean, as we kind of lived through it when I had to go into quarantine, it's incredible. It was hard for us to socially isolate. We had one bathroom. I still needed to go to the kitchen if I could. It's incredibly challenging. So, talk through with your health provider what's realistic for you, and they might be able to kind of help problem solve around things like shared kitchen space, shared bathrooms, that kind of thing.
Well, was there anybody that you guys know that had a positive test and that was able to recover from it?
I mean, I've been really thankful. I don't know anyone personally from my life that's tested positive. There's a few people that sort of suspect they may have had it, but they had it in the early phases where they wouldn't have gotten tested. Mm-hmm. Certainly, obviously at work, I know that we have, there are patients that have tested positive. And again, the majority of them are at home, like recovering from the virus. But we just are thoughtful that, that there's people that need hospitalization and there's people that need sort of serious intervention and treatment to keep them well.
Definitely. And Jared, can you just tell parents where they can go if they want to get any update from the Lynn Public Schools?
Absolutely. Please go to the Lynn Public Schools website, lynnschools.org. Lynn Public Schools is also on Facebook and actively updates it. And I just want to put another plug out there, because this is a public health crisis right now. It's also a really severe economic crisis, and so many families have been hit financially and are struggling. And I would recommend reaching out to Northeast Legal Aid to think through some of the issues that we talked about housing. If you're worried about being able to pay rent or struggling with your landlord, they have housing resources. And then as you think about applying for unemployment and other benefits, resources to help guide you through that process.
And I just also want to highlight, so WIC, the WIC Supplemental Nutrition Program, which is for all pregnant women and for children up to 5, they are still offering all their WIC services. It's all gone virtual, but people can still enroll their children. They can enroll themselves, just to sort of help in any way around sort of food, being able to buy food.
All right. Thank you guys so much for taking the time. Really appreciate this. I'm glad you guys are doing well. You guys and the family are doing well. This was very much appreciated.
Thank you. It's so great to see you, Makala.
Yeah, I know. I haven't seen a barber in a while, so everything.
Yeah, we're all doing our best. Anyway, thank you so much. Stay well, stay healthy.
All right, we'll talk to you guys soon.
All right, take care.
Thank you.
All right, you guys have been watching the Lynn Lowdown. Have a great day.